Hey guys, we're going to finish up chronic musculoskeletal by talking about osteoporosis. So, this is not a type of arthritis, but it is a bone disorder that is a chronic condition. So, here we are. So let's finish strong, which is ironic because we're about to talk about a disease that is about weak bones. So it's hard to finish strong when we're talking about a weak bone issue. But anyway, let's do this fun risk factors question first. So it says, what questions or assessments would be most helpful for a nurse to ask to determine a client's risk for osteoporosis? So there's a couple different ways that you can ask this question. Like you could, a more straight up question would be like, what are the risk factors for osteoporosis? But this is asking you to figure out what are the questions that you would ask. So effectively, which of these questions are going to give you information that's going to tell you that a person, because it also says, by the way, it says most helpful. So some of these maybe could tell us something about a client's risk for osteoporosis, but what are the most important questions? So this is a prioritization, like which of these questions, if I ask them to a patient, could put like big ding, 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 like alarm bells, like this patient is very high risk for osteoporosis. So let's look at them. So first one is, how old are you? So this is really saying, is age a high risk factor for osteoporosis? And the answer is yes. As we get older, our bones get weaker and things like that. So age is a big determining factor. So that is one question I would want to ask. Do you perform repetitive motions daily? So, this has been a lot of the issue for other disease processes and things that we've talked about, like the arthritises. But believe it or not, this is not a helpful question. So, um, the osteoporosis risk is not like arthritis where it's like strain on the joint, so there's not like strain on the bone. A lot of the risk factors I think will surprise you here have to that are a little bit different. Bone density is not necessarily determined by repetitive motions. So that answer is going to be nope. How many drinks do you have daily? This one is a yes. You're going to see um, a lot of the risk factors for osteoporosis are going to be things with lifestyle, when it comes to especially substances, and then it's also going to be things that are non-modifiable. Calculate BMI. So does weight or body mass index have to do, or stature have to do with osteoporosis? And the answer is yes. So this is actually probably one of the biggest risk factors, and this is going to sound strange, but osteoporosis is the only time that I know of. That any disease process that I teach, at least. I'm sure there's other ones out there, but it's the only disease process that I teach this semester that being skinny is not helpful. So the thing with osteoporosis, we'll talk about this more, but it's like the bone isn't dense enough. In order for bones to get dense, they need weight on them. So patients that have a low BMI or a low body weight are actually super high risk for osteoporosis because their bones don't have weight on them to make them strong. So this is like the one thing I remember when I first started teaching this, I was like, the one time my thunder thighs come in handy is with what do you call it, osteoporosis. I am slowly decreasing my risk for osteoporosis one thunder thigh at a time. Yeah, so the actual weight, and it's not that you need to get crazy with it, but actually having weight on your bones does help to decrease your risk of osteoporosis. So this is a helpful question. So alcohol use, age, BMI are all helpful questions. Repetitive motions, not so much. Ethnicity, this is something else to consider. It may not be the only thing, but or like the main thing, but people that are of white ethnicity or Asian ethnicity are going to be bigger, higher risk for osteoporosis. What do you do for work? So this kind of goes back to repetitive motions. It's not the workplace. So that, like, if this would be a great question for someone with what disease? Maybe carpal tunnel. But this is not very helpful for osteoporosis because it's not really a result of that leads to the osteoporosis or the weak bones. What does your diet look like? This is a big factor because if they are deficient in calcium or vitamin D, it can increase the risk for osteoporosis. In order for the bone to be dense, the bone has to be nourished. And then to be nourished, it needs that vitamin D and calcium. All right. How active are you on a daily basis? This is something that could be very helpful for someone with osteoporosis. So not necessarily so much the repetitive motions or the work, but how active they are can be a big determinant because people, if they have low body weight or if they're sedentary, it's going to increase their risk for osteoporosis because they're not putting the weight or strengthening their bones. So that is a yes, their activity level. It doesn't matter what activities they're doing. It is preferred weight bearing. We'll talk about it. But it's not so much about this. Now I know that you could like stretch and be like, well, wouldn't what kind of work they do affect it then? Or if they're at a desk job, don't think into this too deep. Just think overall. Would the information from that question provide me with anything that would show me a risk factor for this? And like as a whole, is it a good question? Do you take steroids regularly? I know you're not gonna like this one, but it's true. And so you might not know this, but steroids break down bones. The other thing, if you don't remember, because I know that you remember everything from the cardiac section, of course, is heparin also increases your risk for osteoporosis. There's a few different meds. So asking about taking steroids regularly could tell you or give you some information that would help you determine that the client may be higher risk for osteoporosis. Are you a smoker? This is just like drinking. Smoking is horrible for the bones. It affects the blood flow and all that stuff and can lead to more porous bones. Do you get sick often? Hmm. You know, there's not really a connection between, frequent illness and osteoporosis. They're kind of unrelated. So, as a whole, helpful question. Age, drinking, smoking, BMI, having that small body stature, ethnicity, what do you call it? Activity level, diet, medications that they take. It's important to know but how if they get sick often, what they do for work, repetitive motions, they're not going to be the best questions to ask for these patients. So let's talk about it. So effectively, a healthy bone looks like this. It's got like a beautiful little, like little patterns. But a person with osteoporosis is going to start to have kind of a holy and not holy like Jesus, but lots of holes or porous, as you think osteoporosis, osteoporous, where it's very what do you call it? There's a lot more openings, more weakness. This doesn't have a strong structure. So think of this as like the foundation within the bones doesn't have the structure in order to hold up the structure of the bone itself. So what happens is when you have fragile, really weak bones, what's going to happen? You're going to be much more likely to have injuries, have fractures, and have lots of issues like that. So what we talked about, it's more common in women than men. Well, we actually didn't talk about that, but effectively the connection there is it all has to do with hormones. And so what they used to do is that like people that when they've gone through menopause and stuff like that, there is the hormonal changes and stuff like that. And so they found that people were getting really, really high risk for osteoporosis. So they started putting everyone on hormone replacement therapy. But then they found that with the hormone replacement therapy, people were getting cardiovascular issues and having a like really bad, serious life and death stuff come up. So now they no longer, and the book talks about this, they no longer recommend doing the hormonal treatments for people after menopause. They might be able to do them short term temporarily if they're having really bad menopause symptoms. But overall, even though it helped with osteoporosis, it caused so many other issues. But hormonal stuff, so, being a woman, being older than age 65, having that low body weight, remember low body weight, less pressure, less, building of the bone to make that strong foundation or strong structure, being of white or Asian ethnicity, a low calcium diet, or not having enough calcium in your diet to build that beautiful foundation and structure, not being a very active person, having a more sedentary lifestyle, and then things like drinking and smoking. And drinking would be more than 2 drinks per day, or, being a smoker. And sometimes, students get caught up on this, pay attention sometimes to these little details, like when it says drinking more than 2 drinks per day. I know sometimes people get caught up in the cardiac section because they're like, oh, well, the question said that they had a drink a day. Well, for some patients, 1 drink a day is okay. But you always want to kind of look at these little fine details when it comes to with alcohol and stuff like that. So, what are these patients going to look like? So, these patients, it's less about symptoms. It's not like a patient comes in and is like, "Oh, my osteoporosis is killing me." What we're not looking for osteoporosis. We're looking for complications from osteoporosis. Usually, the most common places that you are going to maybe see symptoms, if we do see symptoms, it's going to be the spine, the hips, and the wrist. But early on, they might complain of back pain. But after that, like really, the main thing that we see with osteoporosis is falls and fractures. It's the Fs. It's the double Fs. It's like okay, I'm not gonna do that. All right, I was about to say another F word, but I'm not going to, I promise. History of falls and fractures is really what we wanna look for because 'cause we're looking for those, complications. We're not really looking this is not like, again, this is not a bone, like the bones being porous or being, weaker or not as strong, that doesn't cause pain or, it causes problems. It causes issues where their bone is weak so they can fall more. Now, once they fall and have a fracture, yeah, they're going to hurt, but they're not hurting because the osteoporosis, they're hurting because the fall. You can also assess for what's called kyphosis, which is a gradual loss of height, which is in this picture that you can see that kind of get that stooped, bent over posture or that humpback, as some people call it. So how do we diagnose this? Most people would say get an X-ray, but an X-ray is not actually going to tell me. I cannot see porous bone through an X-ray. What I can see is if they have a fracture. So an X-ray would be super helpful if I think the patient has experienced or is experiencing a fracture. But the best test for me, for a patient with osteoporosis is going to be what's called a bone mineral density testing, and also you might see this referred to in a test question as a DEXA scan. And this is going to tell us actually about bone loss. It tells us about the density of the bone, which is the issue here. We may check labs like the calcium, vitamin D, phosphorus. These are all kind of centered together, but it's not that like we go in and we're like, they have a critically low calcium. All they need is some calcium and they're fine. A lot of times these labs are normal, but we're still probably going to check them just to kind of see where they're at, make sure that they don't have some sort of strange deficiency or something like that. Because maybe they have some sort of GI or other issue. They're not absorbing things well. So, what are we going to do medically? Medically, we want to make sure they're getting the nutrients they need, so the calcium and vitamin D, regular physical exercise, getting moving. We'll talk more about that when we talk about the nursing section, but sedentary is not good for these patients. Of course, the biggest thing we're worried about is falls and fractures because, again, there's no symptoms here until there's a problem. Like, there's no problems until there is one with osteoporosis. When they're going to be really high risk for falls, they just don't have the same strength. They can actually have spontaneous fractures. And what I mean by that is like they're not doing anything and their bone breaks. And then they're also more likely, like sometimes you like just bump into a wall or something, or maybe you don't, but I commonly do, or, trip over your own feet, or maybe you just, like kind of like bang into a drawer or something in the kitchen. Like they could have a major fracture from that where you or me just have our shame, guilt, and remorse. So they actually build up like really serious problems when it comes to, like little minor activities and things like that. Additionally, we give medications. The medications are going to help with the underlying problem, which is that their bones are weak. And so we need to strengthen those bones, and we do that with bisphosphonates. And if you said biphosphates for a long time, it took me a while. I actually had a student correct me finally, and she's like, I don't want to hurt your feelings, but it's bisphosphonates, not biphosphates. I think biphosphate sounds better, but whoever created this says bisphosphonates, so here we are. Let's talk about these. So bisphosphonates, and I can't say that. Bisphosphonates are the most common one you're going to see given is what's known as aldendronate, also known as Fosamax. And so, what do you call it? Think fossils are bones, so maybe that'll help you remember that one. And so these help to increase the density of the bone and prevent breakdown of the bone, because pretty much the bone is a very fine balance. Ideally, in a perfect world, as much as bone is breaking down, we're also building it up. We don't want it, built up too much, and we don't want it broken down too much. But what happens is that in osteoporosis, there is a steady amount of building, but there's these osteoclasts start getting broken down, or there's more breakdown than there is building up of the bone. So the bisphosphonates help to counteract that and help to really prevent that breakdown or prevent this extra TNT that's blowing up and causing breakdown of the bone. So there are some special considerations. This can cause really bad GI symptoms. Like we've talked about some like, hey, it causes GI upset, but this can actually cause erosion of your esophagus, some like very serious like esophagitis and other stuff. So you need to take with a full glass of water on an empty stomach, not with any other meds. And then you need to tell the patient to sit upright for at least 30 minutes to reduce the risk of reflux or because again, if this backs up, it can lead to erosion in the esophagus and some real serious complications. So the patient might also, not always, they may receive calcium and vitamin D supplements. The one thing about calcium supplements is they have like this weird thing where, like, there's a finite amount you can take at one time where it's effective. So, in other words, like, usually I want to say it's like around 500 milligrams or something like that. Like, if you just like, if you're trying to like take it all first thing in the morning, it's not going to be well absorbed. You can only, like, there's a finite amount of you can absorb at one time. So these are best spread throughout the day. And it's usually best absorbed with food. So an example, this would be calcium carbonate. Now, most people can get their vitamin D from sunlight and through just basic stuff they're eating in their diet, but some people may need additional replacement. So just kind of keep that in mind that you want to make sure because calcium can't be well absorbed without vitamin D. So they're the two the brothers from another mother that need to be together to work. And what am I going to do as the nurse? It's all about education, lifestyle changes. So, first, when it comes to lifestyle changes, we want to make sure they know about high calcium foods. That's, of course, the easy ones to think of are dairy, but also know spinach is high in calcium. And there's going to be some sort of diet question about gout and or osteoporosis on the exam. So start studying your foods. Then exercise. Like I said, I want to make something specific here. This is where students get confused because they think, oh, any exercise is fine. But what's the issue here is that we have weak bones because we're not putting enough weight on the bones. So we want to do exercises specifically that are going to put weight on the bones. So the best exercise is usually going to be walking, but other things like hiking, stair climbing, tennis, dancing, weight training, something where your bones have to feel the full force of your body weight. So we want things that are upright. We don't want things that are going to like have our legs up or where we're not we're not doing we're not having to deal with the full weight of our body on our bones. We actually want like weight bearing means my body is bearing the weight of all of this stuff on me. And that's the official Merriam-Webster definition, by the way, if you're wondering. But effectively, oh, and I wanted to say one more thing. I know in one of my other videos, I said if English is not your first language, that you might not get my jokes. I also do recognize English could be your first language and you still might not get my jokes. And I'm okay. Like I found with most people that know me closely and intimately, because I do not get close with very many people, that most of the time now they don't really laugh at my jokes. It's just kind of a silent acknowledgement. It's just kind of there. So you can just kind of let it like roll over you or if you're not sure, like it's just always good. And if you need some help, there's great counseling services at most schools and things like that if it's needed. But yeah, so I just didn't wanted to think that I was just calling out people that maybe English is not their first language, because actually a lot of people struggle to keep up with how fast I talk, even though I find it strange that people watch my videos. I hear it like 2 or 3 times speed. I'm like, I talk so damn fast. Like, how do you listen to this so fast? But bully to you if you're doing it. And if you've scrolled past me already, that is just fine. But the point I just wanted to bring in is I know I can be confusing. And if you're not sure, if you're like, is this lady for real? I'm really not. Like I said, I'm full of crap. Um, and somehow still effective at teaching nursing. Maybe it's a requirement. Anyway, back to weight bearing exercises and the Merriam definition of what weight bearing is. Effectively, here you want to think of activities that are going to force you to be upright, standing on your feet, and doing things that are going to put that excess weight on your bones are going to be the best thing. So think of a lot of standing activities, things like bicycling, horseback riding, or things where you're riding on something and then just moving your arms are not going to help. And that sounded really weird. Like, I don't know what activities that would be. So I'm going to keep moving on before I end up in an awkward territory. Other things, of course, we're worried about are fall safety, fall prevention, and safety issues. So we're going to use like a gait belt with these patients, assist them with ambulation, bed alarm on. Because remember, these patients, like with some people, you have to, like, in order for a bone to break, you have to do a lot more. With these patients, it just happens sometimes spontaneously. So super gentle with them and just watching closely. And going back to remembering what are all those signs of a fracture, because with these patients, it may not be like, oh, they had a massive fall and they broke a bone. It may be like, they looked out the window and then their bone broke. So Smoking cessation and limiting alcohol intake can also help to decrease those risk factors. I oh, no, there's more. Okay, yeah, sorry. I was like, "Man, did I add some extra crap?" Yeah, I did. So other things to prevent osteoporosis, we want to screen. Now, it's actually, research has shown that screening is only really for risk factors is only necessary in women older than 65. Um, for um, for men, there's no routine screening needed, even though men end up like this is highly underdiagnosed in men because it's more common in women, but um, there's no evidence to show that men need to be routinely screened. They may have to be tested earlier if they're high risk, like they're low body weight, smoker, prior fractures, things like that. Um, lifestyle things to prevent, like just like so before this is like before you get osteoporosis. Regular weight bearing exercise is good, adequate intake of fluoride, calcium, vitamin D, and then manage and keeping in mind these conditions and medications can also predispose you to osteoporosis. So I kind of talked about it a little bit. People that have like GI issues, if you have issues absorbing nutrients, you can have issues absorbing calcium, which could lead. You could even be doing great with your weight bearing and your weight itself, but if your stomach is just leaching away and not retaining or absorbing your calcium, it can lead to a severe issue. Those with kidney problems can sometimes be more at risk for osteoporosis because your kidneys do regulate calcium, phosphorus, and stuff balance. And then those with hormonal issues. This is not just people in menopause, also people with hyperthyroid, because it can affect some of the calcium and other balances. And then men with low testosterone are also higher risk for osteoporosis. And I brought up some of these meds, but steroids and heparin are two of the meds. And then anti-seizure meds increase your risk for osteoporosis as well as thyroid hormone, because again, it has to do with that. It can affect the calcium balance. And pretty much like when you're in hyperthyroid state, like your body like overdoes it and breaks down more bone than it needs to. And so like if someone has hypothyroidism and is on thyroid hormone, we just worry about them having too high of a dose that could lead to issues and stuff like that. I think I'll leave it at that. All right, now we're done. Not that so I'm not so sad or, to end this, but I know that you are going on to study future things that are not. Now this is really sounding stupid. I know that you are happy that this video is ending and grateful to move on to the next topic. Musculoskeletal can be kind of cool sometimes, but there's again a lot to process. So make sure that you're going, bringing stuff together, starting to ask some deeper questions, teaching other people about this, really trying to connect the dots. Case studies are great, especially for these chronic ones. Start differentiating some of the things that are very similar and start really trying to break down like when would you need to call the doctor? What problems can you have? What are you going to be doing for these patients? What are the priority teachings? I think that's a good place to get you started. Coming later to you at a movie theater near you, going to be thermal disorders, and then we're going to get into neurological, which is kind of cool. See, I'm going to say that from like here on out, things are kind of cool, but not as cool as cardiac. Anyway, have a good night.